Electronic health records. Why electronic health records are the perfect health information technology solution for healthcare professionals. Let's begin with the basic overview of what an EHR is. An EHR is a digital version of a patient's medical record that is maintained by a physician over time. EHRs contain medical treatment history, diagnosis, medications, treatment plans, immunization dates, allergies, radiology, images, and lab results. EHRs offer real-time patient records instantly. Electronic health records will improve workflow efficiency by allowing healthcare professionals to gather all relevant information in one place, like labs and imaging and medications, producing complete and legible records that eliminate guesswork for others involved in the patient's care, improving coordination of care for multiple providers involved in the patient's treatment, enabling evidence-based decision-making at point of care, decreasing medical errors through pop-up alerts, and increasing patient participation in their own. This chart demonstrates the percentages of providers who showed an increase in workflow and patient-centered outcomes within 30 days of EHR utilization. Percentages in a nutshell: 74% increased remote access to patient charts, 74% enhanced overall patient care, 50% were alerted of high lab values, 41% had pop-up warnings for potential medication errors, 39% were reminded to perform routine preventative care, 29% ordered fewer tests due to lab results being available. Financial savings. This demonstrates the projections of financial savings that contribute to administrative costs, billing errors, billing capture, radiology, and laboratory services, in addition to government incentives that come with implementing EHR. When combined, the potential savings for implementation estimate to be around $200,000. Drug savings alone approximate to $44,000. An average of $20,000 would be saved in billing errors. A combination of chart pulling and transcription savings equate to $15,000. Make a case for EHRs. Electronic health records improve legibility and completeness of patient health information by eliminating guesswork in deciphering handwritten notes, increasing efficiency by eliminating unnecessary paperwork, and allowing multiple providers involved in the patient's care to easily read patient history, treatment, lab results, and medication lists. Make a case for EHRs continued. Increases quality of care through better disease management and patient education, greater patient access to records through the use of patient portals, decreases office administrative costs by reducing chart pool, storage, and refiling expenses. Overall, the amount of savings from switching to EHRs allows facilities to allocate monies in areas that improve patient care, like newer medical equipment. Incorporating superior and accurate reimbursement coding improves documentation for highly compensated codes and decreases billing errors. EHR health information exchanges among providers facilitates coordinating patient care, which reduces duplicative treatments and avoids costly mistakes. What business problems do EHRs solve? EHRs will improve public and population health outcomes by making it easier for facilities to collect standardized systematic data that improves reporting capabilities, expanding communication between healthcare providers and public health officials to address areas of disparities, lowering operation costs through cutting down paper waste and decreasing billing errors. What factors affect EHR adoption? External factors, organizations and consumers. Governmental factors, policy and incentives. External factors, organizations. Vendor products are getting better. Organizations are embracing the need to implement EHR systems. Implementation success stories from hospitals are encouraging other organizations to switch to digital medical records. Competition among healthcare providers is forcing adoption, improvements in patient safety, quality care, and clinical outcomes. External factors, consumers. Consumers are increasingly interested in the added benefits of EHR systems. 42% of consumers want to access their medical records online. 55% want to exchange health information with providers via email. 57% want to access medical records, schedule appointments, refill prescriptions, and pay medical bills online. Governmental factors, policy. As part of Health Information Technology for Economical and Clinical Health Act, the federal government set aside $27 billion to incentivize EHR adoption. The incentives will be awarded to eligible professionals and hospitals as they adopt, implement, and upgrade EHR systems. To receive payments, providers and organizations must register for the program, use certified EHR systems, and demonstrate meaningful governmental factors, incentives. The government incentives given to providers and organizations are meant to encourage hospitals and providers to adopt EHR systems, train health information technology workers, assist hospitals and providers in setting up EHR systems, enable health data to be shared among providers through the EHR system. How do HIT leaders feel about EHRs? The good. Improves data accessibility. Order entries are computerized, simplifies charge capture, allows electronic revision and co-signing of notes by a supervising physician, and allows easy communication within and across organizations. How do HIT leaders feel about EHRs? The bad. Decreased productivity and revenue during implementation, lack of interoperability between EHR systems, high purchases and maintenance costs, continuous need for updates. Providers are resistant to change in workflow. User interfaces do not always work well and creates more work than was required. The ugly. Easy accessibility increases the risk of privacy and violations, enables creation of inaccurate medical records through auto-population and copy and paste. What type of technology is involved? EHR systems are an application program designed to perform functions, tasks, and activities that benefit the end user. The software enables appointment management, e-prescribing, electronic billing coding, electronic order entry, and charting. Benefits of EHR software. EHR software allows digitization of medical records in real time, sharing digital medical records with other entities without the hassle of mailing records, patient access to medical records through the click of a mouse, and information to be shared through a network interface between entities. Are EHRs an application? Yes. Electronic health records are run through a software application that makes it possible to create digital versions of medical records. Computer software includes computer programs, libraries, and non-executable data such as online documentation or digital media. The Epic system is a software application vendor that provides services to healthcare companies all across the country. The software is used in community hospitals, rehab centers, and academic medical centers and hospice. Companies should ensure that new EHR application purchases have been extensible databases that meet business and clinical needs well into the future. EHR application support systems include pharmacy, laboratory, and digital radiology. There are millions of patients that have a current electronic health record. Software application vendors' main responsibilities should be to protect patient health records and improve performance. How do we deliver services through EHRs? Identify and maintain patient record, manage medical lists, manage patient history, maintain clinical documents and notes, and manage patient care plan. Patients can message their physicians, attend e-visits, complete questionnaires, schedule appointments, review their labs, and be more involved in managing their own health care. Pharmacy communication, financial and administrative coding assistance, service authorization, and secure data exchange. How might we acquire EHRs as a solution? EHR vendors must be qualified and certified to provide services to companies. Consumers should proceed with the following steps when evaluating systems. Step 1. Do your homework and research. Compare multiple EHR systems. Step 2. Look up vendors through class website to view consumer ratings and reviews. Step 3. Set up meetings with prospective vendors. Step 4. Make a checklist of questions to ask the vendors. For example, is privacy insured? What is the base price for your system? What are the contract terms and conditions? Is the system user-friendly and efficient? What customization options are available? Can the system be integrated with existing software packages? Step 5. Analyze the results and determine the best EHR solution for your practice. Keep in mind that in addition to costs, vendors may charge fees such as a one-time software license fee, annual maintenance fee, which includes support and upgrades, and implementation fees. Adopting EHRs is beneficial for both providers and hospitals. In 2015, the Centers of Medicare and Medicaid Services paid more than $30 billion in financial incentives to more than 468,000 Medicare and Medicaid providers that implemented EHR systems. Who is using EHRs and what do they think about it? Physicians, nurses, and healthcare staff at hospitals, clinics, healthcare facilities, and private practices use EHRs. Professional satisfaction. In 2011, 54% of physicians had adopted an EHR system. Out of 85% of physicians who adopted an EHR system, 47% reported being somewhat satisfied, and 38% reported being very satisfied with their system. About 3/4 of adopters reported that using their EHR system resulted in enhanced patient care. Nearly 1/2 of physicians currently without an EHR system plan to purchase or use one already purchased within the next year. Professional dissatisfaction. Time-consuming data entry. Template-based notes degrade the quality of clinical documentation. User interfaces that do not match clinical workflow. EHRs threaten practice finance. How does using EHR impact the patient? Less amount of paperwork and fewer storage issues decrease storage space required of housing, paperwork, and medical records, and reduces office clutter and occupied space, which provides open spaces for patients and improved workflow for staff. Increases efficiency and productivity, permits each EHRs to create centralized chart management systems, and grants quicker access to patient information from financial incentives, improves worker satisfaction, contributes to less turnover of the staff, leads to more experienced employees, allows improvements to facilities which create safer and better quality of care to patients, improves health. Patients access to EHRs which can send automatic reminders for preventative visits and screenings. Patients are able to manage their conditions better and participate more fully in care. Safe medication administration. Electronic prescriptions allow physicians to communicate directly with pharmacies. This reduces errors and saves time by eliminating lost prescriptions, which improves patient safety. Electronic prescribing automatically checks for potentially dangerous drugs. How do we assign value to EHRs? Meaningful use sets specific guidelines that eligible professionals and hospitals must achieve to qualify for Center for Medicare and Medicaid Services incentive programs. Meaningful use expects certified electronic health records technology to improve quality, safety, and efficiency, reduce health disparities in impoverished communities, engage patients and families in their care, improve care coordination with multiple providers, improve population and public health, and maintain privacy and security of patient information. Ultimately, it is hoped that the meaningful use compliance will result in better clinical outcomes, improved population health outcomes, increased transparency and efficiency, empowered individuals, more robust research data. Conclusion. Though there has been some delays in accepting EHRs, it is proven that both healthcare providers and patients will benefit from its use. Many factors impact its implementation, including organizations, consumers, policy, and incentives. Various software options are available for use that comply with Centers for Medicare and Medicaid Services programs. And moving forward, experts predict EHRs will be a critical tool to support changes necessitated by the massive transformation of the U.S. healthcare system.